Hey everyone, thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. Hope you had a wonderful weekend. Hope your week is starting off nice here now that we're into this Monday. We've got a great show for you today as we take you to the rundown. We'll have Cornerstone Wellness Center starting us off, talking treatments for neuropathy. Then food expert Rachel Bukowski, she is introducing us to some trendy grocery items. And then zero-res carpet and air duct cleaning with a TV special for Wave Listens viewers. But let's start things off with Cornerstone Wellness Center and Dr. Doug Kane joining us here in studio. Always great when you're here with us. Good to see you again.
Thanks for having us, Brian.
All right, let's talk first and foremost, because you always have such great information for people who are suffering from neuropathy. Let's talk what it is and some of those early indicators that you may have a problem.
Sure. So neuropathy is the #1 neurological diagnosis we see in America today, more than Alzheimer's, more than Parkinson's. And just like those, it's a progressive degenerative neurological condition. At least that's what we were all taught in school. Fortunately now, we have technology and protocols and the ability to help reverse that. So I've been doing that for 7 years. We've got between a 96 to 98% success rate over those 7 years. How a neuropathy affects people is it will start off, it can affect any nerve in the body, but it's generally the feet and sometimes the hands. It's generally brought on, the most common cause is diabetic neuropathy. We see it with chemotherapy-induced neuropathy, which is what my mother had and why I got involved in this. We see chemical-induced neuropathy, alcoholic-induced neuropathy, as well as orthopedic injuries or surgeries such as hip and knee replacement, ankle injuries, and so forth. The first signs a lot of people have is a feeling like they have like a pebble in their shoe or a wrinkle in their sock, and then that will just kind of intensify over time. These people are afflicted with extreme, intense pain. They don't want to be on their feet. They don't want to do anything. It affects their sleep, so they're not getting good, healthy sleep. My mother couldn't feel, or she couldn't tolerate the covers touching her feet, so she'd pull those up at night. Other people deal with numbness, and they'll actually sometimes have to look down as they're walking to see where their feet are. And that can lead to fall risk, broken hips and shoulders, head injuries, and sometimes, unfortunately, those are fatal.
Yeah, and even without the severe injuries, just the quality of life that you experience when you're going through something like this untreated, I can't even imagine what it's like for some of these patients. You mentioned something a minute ago that early on, even in your career, you were used to people saying, hey, there might not be anything we can do treatment-wise. That is something that has changed majorly over the last half decade to a decade.
Yeah, well, like I said, I've been doing this 7 years. If you'd asked me 8 years ago, I would have looked you right in the eye and say, I'm sorry, there's nothing you can do. You just have to learn to deal with it, because that's what I was taught. Unfortunately, this is even though I've been doing it for 7 years, it's still a newer protocol, and that information hasn't filtered down to a lot of our medical doctors, our primary care doctors, our neurologists, orthopedists, and so forth. So as that information is getting out there more and more readily, I'm having doctors send me patients from as far away from Bloomington to Corbin, Kentucky.
As you now have this technology on your side, and you do have a treatment option available, we're going to show some video. Last time you were here with us on Listens, you brought in a patient, and we went through the actual treatment here. Let's talk about what that option is for some patients and exactly how it works, because I know everybody's always so curious, especially longtime sufferers, and they hear, wait a minute, there is something I can do about this.
This has been an absolute game changer. You can see Ireland using the device there. It's called SoftWave TRT. That stands for Tissue Regeneration Therapy. This is from Germany. There's only about 1,100 units in the world. About half of them are in the States, primarily in research institutes like Mayo and Harvard. A lot of professional sports teams have them. Our trainer, when he was here with us a month ago, said that he had just delivered the 4th unit to the Los Angeles Lakers. This show was actually, or this device was actually featured last November on the television show The Doctors, and they referred to it as the stem cell machine.
Okay.
And that's one of the most important things that it does. It's non-invasive. You can see there's no needles, there's no medications, so there's no chance for any infection or any interactions.
And this patient here, because we were doing this live on the set, he was doing an interview just like you and I are doing right now while this was all going on to show you that this isn't something that is a entirely painful process. He was just going about answering questions like it was any other day.
Yes, it's not painful at all. You will feel a little bit of a thump per se. It's called soft wave. It treats with a shock wave. A shock wave is very much, you know how like thunder can rattle the windows of your house? That sound energy, well, that sound wave has energy. And so that's what this machine is doing. It is shooting a sound wave into the body. This wave will help wash out a particular, it's called prostaglandins. It's the chemical that's responsible for pain. So this is good for both acute and chronic pain. It increases capillary blood flow by 300%, which helps promote healing. But the big thing it does is it stimulates your body's own stem cells. And that's what helps us heal. And that will continue to work 8 to 12 weeks after each individual treatment.
I think what is something that is so important to touch on here, as we're seeing again some of this treatment being done right here in Louisville, Kentucky, through your office, is you mentioned the Los Angeles Lakers. This is I think, top 10 earnings organization in the sports world, and they use these on their top tier athletes. Yeah. Only 1,100 of these in the world, and we have one with access to it through you right here in our own community. Yeah. That's major.
Yeah, it was a big investment. But like I was telling you earlier off screen, we have a doctor that is in Evansville that works with PGA, works with Olympic athletes. His son is an elite runner, but has had an injury that he's been dealing with no resolution for about 6 months. So he's been coming here because we are the closest one to Evansville. I think Clarksville, Tennessee was the other one. But in his first treatment, which took about 8 minutes, as soon as he got off the table, he said it was 50% reduced and better than it had been in almost 6 months. So we're going to be able to get him back to running. He's also an elite soccer player, and this is a kid, if we get him healed like we should be able to, you know, he's probably going to be a candidate for a scholarship.
And great for different age ranges, because the patient you had in here, he skewed on the older side. You mentioned the PGA. Golf was something that was a big part of his life, and he was hoping to go and play after he finished treatments that day.
And I believe he did. Yeah, he's a good friend of mine. He's going to be retiring here in about a month, and there's going to be a whole lot of golf. So it's great for a lot of different conditions that you can see on the graphic there. It has been a huge game changer for our neuropathy patients. Patients that have significant neuropathy for long periods of time will actually see, because of poor circulation, the skin will change color. It will be dark. It'll be like it's bruised. When we do one of these soft wave treatments, in a 20-minute treatment, we can see that tissue pink up. We had a gentleman that was near tears a couple of weeks ago because he could feel the soft wave machine, and he said it was the first sensation he was been able to feel in his feet for 20 years.
It's amazing. Well, we appreciate the work that you do in bringing this to our community. Before we let you go, just a quick update on how we can get in touch with you, especially folks who've been suffering from neuropathy for a long time.
The best way is call the number on the screen. My staff is standing by. A lot of times we'll hear from people that have seen us on this show, you know, 6, 8, 10 months ago. Give us a call today. In 3 months, you can be out of pain or a whole lot better than you are today.
All right, Dr. Doug Kane, Cornerstone Wellness Center. Thank you again, and it's always great to see you here on Wave Listens Live.
Thanks for having me, Brian.
All right, stay with us here. More segments coming your way. We're talking trendy grocery items next with Rachel Bukowski. Don't go anywhere.